Biobank is incredibly important, I feel, because it gives us an opportunity to gain access to primary material. One thing as a scientist has really impressed me is just, in many ways, how cell lines and animal models are rather poor reflectors of what's really going on in patients. So I'm at the NCRI Conference this year, and there have been several presentations on how heterogeneous tumours are, how many various cell types there are in a tumour. And that's not really reproduced by a cell line which comes from an individual cell, often a very resistant one and very atypical one. So by getting access to primary material, we have a real chance to see what tumours actually are like in patients. Well, it can be important in a whole variety of ways. For a start, we can understand more about the biology of cancer by having access to primary material. We can look at the mutations in the cancer. We can find out which mutations are likely to lead to new drug targets. And also we can develop new diagnostics, new biomarkers. So without that access, none of that work would be possible. Yes, rare cancers are a real challenge, and in many ways, with treatment stratification coming along for the common cancers, all cancers are going to end up being rare soon. Right down to the individual level, you could argue, but in many cases, individual confirmations of tumour types will only happen in maybe 50 or 100 cases. So the future is rarity of all tumours, if you like. My own particular interest is in childhood cancer, which mercifully is rare, so we've always had the challenge of collecting samples from multiple sites. So if you want to study a rare tumour or a rare tumour subtype, you have to get collaboration between many centres. And that poses quite a challenge. And the challenge is more one of bureaucracy and communication. I'm very interested in communication, not particularly interested in bureaucracy. In the case of children's cancer, definitely across Europe, in many cases collaborating with our colleagues in North America, of course, too. And for the rarer tumours like the gastrointestinal stromal tumours, the GIST tumours, which I've got particular interest in at the moment, that's very much the case. We'll have to collaborate all across Europe to be able to assemble even 50 or 100 cases that we can study. Yes, I mean, pathology is in many ways an art as well as a science. It involves personal interpretation. Pathologists are very good at comparing their opinions, but actually one of the things you can do in the biobank is by taking digital images of slides, provide a pathology laboratory without walls. People can compare their diagnoses with the diagnosis of an expert in Germany or France or Holland, for example. That's the great hope, of course. For all tumour types, there's room for improvement. And in many of the rarer cancers, that's very, very true. So another area I'm interested in, bone cancer. Treatment rates in many types of bone cancer are still very poor. And therefore, getting access to material from across Europe and across the world to be able to identify those new targets in those biopsies is vital, really. I think it's an ambitious target, and the only thing that stands in the way really is the will to do it and, of course, some money. The amount of money compared with many of the things we do on an international level is quite trivial. It's more a question of people believing that cooperation will lead to advance. I happen to believe that very strongly.